Good morning, everyone. Welcome to the quarterly school-based Medicaid random moment time study, or RMTS, and school-based medical administrative activities, or SMAA call. My name is Edgar Dominguez, and I am an analyst with the SMAA unit, and will be presenting today alongside Jorge Alvarez, also from SMAA, and Leilani Perez, an analyst with the local educational agency Medical Billing Option Program Provider Relations Unit, or LEA-BOP. Both teams work together closely to facilitate the random moment time study throughout the state of California. Before we move forward, I want to briefly explain the purpose of the SMAL program. The SMAL program reimburses school districts for certain admin activities that help administer the Medi-Cal program. These activities include outreach and referral, assisting families with Medi-Cal applications, program planning and policy development, and MAL claims coordination. Today's meeting is an opportunity to share updates and guidance related to both RMTS and SMAL. The main topic we will share today will be the importance of the moment notification and response timeline. This will include updates to the timeline, followed by best practices for moment responses, which includes information on moment documentation. The agenda for today's meeting that reflects the topics we're going to discuss today was sent out Wednesday, May 13th, and the slides were sent out this morning. Both were sent via eBlast. Moving ahead to a few logistics. First, feel free to have your camera on or off during this meeting, whichever you prefer. For today's meeting, we'll be using the Q&A feature, which you can access by clicking the Q&A icon on your toolbar, as shown in the graphic here on the right. A Q&A window will open on the right side where you can type and submit your questions. Some attendees may not see the Q&A option depending on the device they're using. If you do not have access to the Q&A feature, please email your question to rmts@dhcs.ca.gov, as we will not be using the chat for questions. Time permitting, we will take live questions at the end of the presentation. In the meantime, please keep your microphone muted to avoid background noise. Live captions are available for anyone who needs them. The graphic on this slide highlights the steps to enable live captions with arrows pointing to each option in Teams. Just a quick note, the menu may look different depending on whether you're on a computer, tablet, or phone. If you don't see the language and speech option, try More, Settings, and then Accessibility to find Hearing and Options. Different devices may show controls in different places. On this slide, the listserv web pages for both programs are displayed. If you would like to stay updated on LEA-BOP and SMAL program information, you can fill in your name and email address and then hit the subscribe button. DHCS communicates through the LEA-BOP and SMAL listservs regarding important program information. Please sign up today if you haven't already. Please do not email the LEA or SMAL inbox to sign up for the listserv or request to sign up another employee. We cannot subscribe or unsubscribe for you. Before we jump into the presentation, we want to ensure that you are properly introduced to the term RMTS Administrative Unit or RMTS AU. Some of you may have already heard this term from the LEA-BOP April 2026 quarterly meeting, but we want to define it here to ensure everyone is aligned. This term refers to the Local Educational Consortium, or LEC, as the RMTS Administrative Unit, or the RMTS AU for short, in alignment with the new time study implementation plan that was submitted to the federal government for approval. We will be referring to the plan as the TSIP. This adjustment in language is because while each LEC independently coordinates the SMAA program, not every LEC independently administers the RMTS, as some LECs operate a joint RMTS and share responsibilities. As such, when discussing RMTS roles, responsibilities, and requirements, it is important to be clear as to which function or role we are referring to. RMTS AUs run the random moment time study, which is a crucial part of the payment methodology for LEA-BOP and the SMAA program, while LECs administrate the SMAA program. Throughout this session, you will see words bolded in orange. Those in orange represent new information to reflect proposed changes for RMTS in the Time Study Implementation Plan, or TSIP, that is currently pending Centers for Medicare and Medicaid Services, or CMS, approval. Before we move on, we've also prepared a short list of commonly used acronyms for today's session. That list will be shared in the chat, so feel free to pull it up and keep it handy as a reference throughout the presentation. A few acronyms you'll hear often include CQ for clarifying question, LEA for local educational agency, and TSP for time study participant. I will now hand it over to Jorge for the first section.
Okay, thank you, Edgar. In this section, we'll go through the updates to the RMTS moment response timeline and why it is important. In the drafted TSIP, language was proposed that updates the current RMTS moment response timeline to a shortened window. This is to align with CMS requirements. On the screen, you will see in orange the updated language to the timeline, which reads, TSPs will be notified of their sampled moment data and time up to 1 day prior to the sampled moment. At the prescribed moment, each TSP is asked to record and submit their activity for that particular minute. All TSPs that have not completed their moment response within 1 day after the selected moment will receive a late notification prompting them to complete their moment within the required response timeframe. TSPs are given 3 standard LEA working days to respond, starting the day after the assigned moment. The previous language allowed 1 student attendance day for notification of a moment, which has been changed to up to 1 day. There are 2 important things that need to be noted here. 1, we have moved away from student attendance days and now we'll be using LEA working days. This aligns with the payment methodology that both SMAA and LEA BOP uses, where federal reimbursements are drawn down from all the days LEA staff are working, including days when students are not present, but staff are still working. And 2, it is possible there will be no prior notifications since they can be up to 1 day. Such instances for this can be the first day of school. Next, the prior response period was 4 student attendance days, which has been changed in our proposed to CMS to 3 LEA working days. DHCS will continue to encourage LEAs to respond within 2 days, as required by CMS, but we hope to receive approval for a 3-day response window from CMS. Now, what does that mean? That updated language mean for RMTS moment notification and response? So first, the TSP may receive a notification that they have been selected for a moment. This notification is sent up to 1 day before the moment occurs. This means the TSP may or may not know ahead of time that a moment is coming and a response will be required. Next, when the moment date and time occurs, the TSP should continue their work as usual. There's nothing special the TSP needs to do at the exact minute other than perform their normal job duties. After the moment occurs, the TSP is encouraged to submit their response within 2 LEA working days, again, noting that DHCS aims to align with CMS requirements. So is it important to start prepping TSPs to respond to their moment as soon as they receive the notification? In some cases, if the original response does not include enough detail, the TSP may receive 1 or 2 clarifying questions or CQs. If this happens, the TSP should provide as much detail as possible to clear up any confusion. CQs are an opportunity to add missing content or provide clarification so the activity can be fully understood. When a TSP receives a CQ, they will have 5 LEA working days to respond. If a second CQ is required, the TSP will again have 5 LEA working days to respond. Responding to both moments and any CQs accurately and on time helps ensure the TSP's work is properly represented and supports correct coding and reimbursement for the LEA. So why is responding to moments important? For the RMTS to be reliable and statistically valid, LEAs are required to have an 85% moment response rate every quarter, meaning a minimum of 85% of the issued moments must have a valid response within the required timeline. So every moment matters when it comes to TSPs needing to respond to their moments. The 85% rate is a compliance test that ensures that at least 85% of the moments received a valid response for each LEA. An 85% response rate helps ensure that RMTS results accurately reflect the activities of the entire population being surveyed. DHCS analysts show that P.O.I.N.T TSPs, or the administrative staff, respond to a lower rate compared to those of P.O.I.N.T, and at times the response are less than 85%. This can negatively impact the overall response rate and place the LEA at risk of noncompliance. It is important to emphasize that TSPs who respond late or do not respond at all directly reduce the LEA's valid response rate. Late and missing response lower the proportion of valid moments, which impacts compliance and can jeopardize RMTS statistic validity. LEAs should proactively encourage and support TSPs to respond to moments on time to ensure they meet the 85% requirement each quarter. One way to maintain compliance is to create and maintain an accurate TSP list, which we will go over in more detail in future meetings. Remember, RMTS is for the entire region, so each LEA impacts not only their reimbursement, but those of their region and consortia as well, in the way that the overall RMTS percentage for the SMAA invoices and the direct Medi-Cal service percentage for the LEA BOB cost report. Responding to a moment is directly connected to reimbursement for LEAs. Each RMTS moment captures what an individual staff member was doing at an exact moment in time. And those responses are later reviewed and assigned an activity code based on CMS guidance. These activity codes determine whether the moment is reimbursable or non-reimbursable through LEA BOP and SMAA, as well as federal reimbursement amounts. Clear, accurate, detailed, and complete responses help ensure moments are coded correctly and consistently. We will now go over examples of strong moment responses in the next section, and I will hand it over to Leilani.
Thank you, Jorge. In this section, we will go through best practices for moment responses and talk through what constitutes an effective moment response. CMS has released guidance on best practices for complete moment responses, as shown on this slide. They have created the acronym P.O.I.N.T to promote and identify responses that are thorough enough to adequately support coding decisions. Let's break down the P.O.I.N.T from a TSP's perspective. P is primary focus. What was the primary topic or focus of the TSP's activity? O is objective. Why was the TSP completing this activity? I is insight. Did the TSP provide insight for the activity that they were performing? N is necessary detail. Did the TSP provide an appropriate level of detail in their moment response? T is timely. Did the TSP respond in the appropriate timeframe allowed? As a TSP, using the P.O.I.N.T framework helps you confidently respond to moments, reduces the likelihood of clarifying questions, and supports accurate coding and reimbursement for your LEA. A good moment response is clear, descriptive, focused, and will demonstrate whether the activity was in support of a Medicaid reimbursable service. At the top of this slide, you'll see a moment response from a TSP, and we'll evaluate whether the response gets to the point. Who were you with? No one. I was by myself. What were you doing? I was documenting 30 minutes of pragmatic speech therapy services for a student. Why were you performing this activity? The purpose of documentation of speech services is to record the activities required to implement the student's IEP. The first component of the P.O.I.N.T acronym relates to identifying the primary focus of the activity. This moment clearly identifies the primary focus as documenting services. Next, the moment details the objective of the activity. In this case, the TSP clearly included why they were completing the activity, which is to implement the student's IEP. The moment also provides sufficient insight on the activity by sharing that this was documentation of a speech therapy service. They even specify the type of speech therapy by noting it was pragmatic speech therapy services. Fourth, the moment response includes the necessary detail required to understand the activity. The participant clearly paints a picture of what they were doing, who they were with, and why they were doing the specific activity at the time of the moment. Additionally, the moment is not overly descriptive. Instead, only the necessary information required for the reviewer to gather a clear understanding of the activity is relayed, appropriately excluding extra detail or personally identifiable information. Lastly, this moment was submitted timely, which is the T in point. While timeliness cannot be determined based on the content of a moment, the link to complete the moment will expire after the grace period has lapsed. The RMTS software system will hold the date and time of the moment and the response so that DHCS could prove that the response was submitted timely if needed. As you can gather from this slide, if a participant does not ensure that their moment gets to the point, it can pose challenges for the reviewer to sufficiently review and understand the moment to be coded appropriately. On this slide, we are displaying another way that you can think about ensuring a moment gets to the point. We have broken down the important components of a narrative response to help determine if a TSP has complete information for an effective response. When reviewing the narrative response of a moment, it can often be helpful to take all information answered to the narrative questions and look at it as a singular sentence. This can help you see all the important information conveyed in a single place to help determine if there is adequate information. A TSP's response should include: a complete response clearly identifies the action that was taking place. This means describing the specific task being performed and your role in that activity, rather than using general or broad terms. Some questions to ask yourself to identify the action are: does the response detail the specific action that was occurring? Does the response clearly detail the TSP's role in the action? Doing the action, the response should also identify the recipient of the action, or who the activity was for. This helps clarify who was impacted by the work being done, such as a student, group of students, or the program more broadly. Some questions to identify the recipient are: does the response clearly detail who was receiving the action? Does the response detail all parties directly impacted by the action? Finally, the response should include the reason or context for the activity, explaining why the activity was performed and whether it was related to a care plan, assessment, or service. Help show how the activity supports the Medicaid program. Some questions to identify the reason or context of the activity are: does the response detail why the action was being taken? Was the action pursuant to an IEP, IFSP, or plan of care? In the example, the moment narrative was rewritten into a single sentence that identifies the action, recipient, and reason for the activity. The action was that the TSP was doing a categorization. The recipient who received the service was a student, and the reason or context for the TSP doing a categorization was because it was in their IEP and pursuant to a doctor's order. If the example moment didn't include all the necessary information, action, recipient, and reason or context, then it requires a clarifying question from the TSP to gather the missing components. Clarifying questions, or CQs, are open-ended questions that are posed to a TSP. Sometimes, after submitting a moment response, you may receive a clarifying question or CQ. A CQ is simply a follow-up request for additional information about the activity you described in your moment. CQs are used when the original response does not include enough detail to clearly understand what was happening during the moment or why the activity was being performed. Receiving a CQ does not mean the response was incorrect or that anything was done wrong. It just means that more information is needed to fully capture the activity. If you receive a CQ, the TSP will have 5 LEA working days to respond. The goal when answering a CQ is to provide additional clarity about the same moment in time, not to introduce new activities or describe something that happened later. It's important to respond to CQs thoughtfully and within the required time frame. Just like moment responses, CQ responses should clearly explain the activity using complete sentences and enough detail to stand on their own. The best way to avoid clarifying questions is to provide a complete response the first time by including the key components of a strong moment response. which are the action, the recipient of the action, and the reason or context for the activity. When responses get to the point, clarifying questions are often not needed. For strengthening moment responses, we will first discuss a new change to the moment question asked to P.O.I.N.T TSPs. Was the activity an assessment, screening, or a service included in a care plan, such as an IEP, IFSP, IHSP, 504 plan, etc.? Previously, this P.O.I.N.T moment question was asked as an introductory pre-question. However, the answers often contradicted TSP's narrative responses for the subsequent moment questions as shown in the example below. As you can see in the example, the response to the pre-question and the response in the narrative are contradictory. The pre-question response indicates that the activity is not related to a student's IEP, IFSP, or other care plan. However, the narrative specifically calls out that the activity was related to a student with an IEP. If the activity described is linked to a student's IEP, IFSP, or care plan, then the pre-question response will be yes. Remember that even though this response is an activity that is happening outside of a direct service with the student, it is still an activity that is connected to a student with an IEP. This includes time before or after a service. Because of frequent misalignments between a TSP's P.O.I.N.T question response and narrative response, this P.O.I.N.T moment question will be asked at the end as a concluding post question after the narrative moment responses effective July 1st, 2026. It is important to be cognizant of all your responses to the questions. Before certifying, make sure all information is accurate and aligned to reduce confusion or the need for clarifying questions. Since TSP responses directly impact your LEA's ability to receive federal funding, we will now go through these 5 common gaps that can be avoided, which will strengthen moment responses. 1 is response does not appropriately answer the question. 2 is response lacks detail or context. 3 is response includes multiple activities occurring at time of the moment. 4 is response includes acronyms or internally used language. And 5 is TSP fails to respond by the deadline, which is 3 days pending CMS approval. Next, we will go through poor responses for each gap and how they can be improved. Starting with gap number 1, the response does not appropriately answer the question. As you can see on the slide, the top example highlights the importance of sufficiently answering the question being asked. As you can see in the ineffective response at the top to the question, "What were you doing?" the TSP simply noted that I was doing my job. This response provides no detail or insight into the actual activity occurring at the time of the moment, making it nearly impossible for anyone reviewing the moment to know what was happening. The response at the bottom is much more effective, clarifying the activity they were performing. A response does not need to be long to be effective. If the TSP concisely states exactly what they were doing, it keeps the response focused. Gap number 2, the response lacks detail or context. On this slide, we will see an example of a vague versus descriptive response. The top response of doing paperwork does not provide any context or detail as to what the paperwork was related to, which would help the reviewer understand the nature of the activity. The second example below is much more descriptive. In the response, they are essentially calling out that they are completing paperwork, but also provide detail as to what the paperwork is and why it is being completed. Next up is gap number 3. The response includes multiple activities occurring at the time of the moment. This is a common error. When a participant provides detail on multiple activities when responding to the "What were you doing?" question, as you can see in the example, the individual reported that they were performing several distinct activities: monitoring readings for diabetic students, answering calls and emails, planning screenings and assessments, and documenting IEPs. However, it is unclear what activity the TSP was performing during their 1-minute sampled moment. In this case, the participant will receive a clarifying question, requesting detail to narrow down the activity that was completed at the time of the moment. In the second response, if the TSP clearly noted a singular activity, it would be much easier to determine how that moment would be coded by using the "Who were you with?" and "Why were you performing this activity?" narrative responses from the TSP. This example highlights the importance of remembering that a moment is a snapshot of 1 minute in time. Therefore, it is important to focus the response on the specific activity for that 1 minute. Now on to gap number 4, which has to do with responses that include acronyms. Acronyms in shorthand language may be familiar internally, but it might not be known to the person reviewing the moment. Take the time to write out the full phrase instead of using acronyms. In the top response, you see two acronyms, CFT and JPD. The revised response removes the acronyms so that the person coding this moment has the information on the type of meeting and the department that was involved in the meeting. Responses should be written so that anyone externally can clearly understand the activity without additional explanation. Finally, gap number 5 is failing to respond timely. Once the grace period after the moment date and time has passed, the TSP can no longer respond to the moment. This means that even if the TSP was doing a Medicaid reimbursable activity, it cannot count toward the RMTS quarterly results. Non-responses can hurt the overall results and can impact the sample being statistically valid. DHCS has approval to run the RMTS and use the results to help allocate the LEA's cost to Medicaid. If the RMTS fails to meet statistical validity, the ability to use the results comes into question. It is important to work with TSPs so that they understand their participation is important and impacts the LEA's funding. Please note that the response period is subject to change July 1st, 2026. Now that we have reviewed the common gaps, let's focus on best practices to support an effective response. First, submit your response as soon as possible after you receive your moment. If you cannot respond immediately, jot down what you were doing at the assigned time so that you can recall details and submit your moment later. Obviously, trying to remember what you were doing for a 1-minute snapshot in time when 24 hours have passed can be a challenge, so respond or make notes as quickly as possible. Next, use complete sentences. Writing in full sentences helps clearly communicate what was happening during the moment and reduces the chance that your response could be misinterpreted or need follow-up. Next, focus on describing the singular activity that was occurring at the moment. Even if the TSP is juggling multiple tasks that day, the response should reflect only the activity conducted during the specific 1-minute snapshot. Providing enough detail is key. Clear descriptions help reviewers understand the activity without needing additional clarification. Taking an extra moment to explain what you were doing and why the activity was being performed can often prevent clarifying questions later. As we mentioned in a previous slide, it is important to avoid acronyms, unless they are fully spelled out in one portion of the response. Responses should be written so that someone outside your organization could understand the activity without additional context. Finally, remember not to include names or any student identifying information. Descriptions should focus on the activity and its purpose while protecting privacy. Following these best practices helps ensure your responses are clear, complete, and easy to understand. TSPs need to be trained on the importance of providing clear, detailed moment responses, since the quality of those responses directly impacts compliance, coding accuracy, and reimbursement for the LEA. To help your TSP succeed and ensure your LEA remains compliant, the P.O.I.N.T framework can help guide TSPs in writing responses that are clear, complete, and supportable. This gives staff a consistent structure to follow and helps reduce clarifying questions while improving coding accuracy. Review past moment responses to identify common errors or trends. Looking for patterns in vague responses, misaligned post questions, or missed deadlines can help pinpoint where additional support is needed. This information can then be used to tailor trainings to address specific gaps, rather than providing additional general reminders. Finally, refer your TSPs to the RMTS Quick Reference Guide as an ongoing resource that they can use when responding to moments. This guide has FAQs and includes examples of insufficient responses and suggestions for improvement. I will now pass it over to Edgar for the next section.
Thank you, Leilani. Now that we have discussed best practices for moment responses, let's go over documentation to support these moment responses. Documentation is an important component of the RMTS process and essential for program compliance. As we discussed in the last section, narrative responses should be detailed enough so that an independent person can understand what the TSP was doing and why they were doing the activity at the time of their moment. Documentation serves three purposes. First, it supports the code that was assigned to the moment. Second, being able to provide supporting documentation upholds the integrity of the time study. And finally, it protects the LEA if there were to be a federal audit. In past OIG audits where documentation was requested to support under detailed moment responses, when proper documentation was not found, the moments were disallowed. So, as we move through the next slides, keep in mind that the goal is to have a mechanism in place to maintain documentation to support your TSP's moment responses. Now, we move on to LEA documentation that are split into two categories. For direct service moments, documentation may include a student's care plan, authorization of services, date of service documentation, signed clinical notes and treatment logs, practitioner licensure/certification and qualifications, practitioner schedules and payroll records, contracts with medical providers, and a copy of service claims to DHCS if applicable. For administrative activities, the narrative responses serve as the primary documentation and needs to be thorough enough to confirm the activity performed at the time of the moment. In addition to the narrative response, LEAs must maintain PTO documentation. LEAs can also provide additional optional documentation that could help further support a moment, such as Medicaid outreach flyers, referrals, and calendar/emails or meeting notes indicating Medicaid policy development. So now that we have discussed documentation requirements and best practices, over the next few slides, we will review examples of direct service moment responses and the documentation that could be maintained to support the coding that the direct services are reimbursable services. Here we have an example of a moment response by a physical therapist in P.O.I.N.T. Following that, you'll see some examples of possible direct service documentation that could support the moment response. The TSP is asked the following questions. Who were you with? This TSP answered that they were with a student. What were you doing? This TSP answered that they were in a therapy session. Why were you doing this? This TSP was performing the therapy session as the student's IEP requires physical therapy services twice a week. Finally, TSPs in Pool 1 are always asked the question, was this activity related to an assessment or screening or related to a service that is authorized in an IEP, IFSP, or other service/care plan? For this moment, the TSP answered yes, the student's IEP/IFSP. In this example, the TSP is performing a Medicaid covered treatment service pursuant to a care plan. To support this particular response, let's walk through some possible documentation that the TSP can maintain as proof that the moment is a reimbursable direct service. The student's IEP. The IEP can provide proof that the therapy session is medically necessary for the student. Progress notes with the date of service and the detail of session. Progress notes can support services indicated in the IEP were provided on the day of the moment. The TSP's calendar showing that they were in the therapy session during the assigned moment. The calendar entry can support what the TSP was doing at the time of the moment. And finally, the attendance records that support the student was at the school on the day of the moment. Attendance records can help prove the IEP student was at school and could participate in the therapy session. As you can tell in this example, each piece of supporting documentation helps provide proof that this moment was for an eligible direct service. Here we have an example of a moment response by a credentialed school psychologist in Pool 1 and possible direct service documentation for their moment response. When asked, who were you with? The TSP answered that they were alone. What were you doing? The TSP answered that they were writing a report. Why were you doing this? This TSP detailed that they were summarizing assessment results in preparation for an upcoming IEP meeting. Similar to the last example, the TSP answered yes in the response to the post question, indicating that the activity at the time of the moment was related to an assessment/screening. It is important to understand that summarizing assessment results is considered an extension of the direct medical service or the assessment. Reimbursable direct care services encompass all pre and post-service time directly related to providing the service. even when the student is not present. This includes time related to preparing for a service, completing paperwork related to the service, preparing progress and session notes, traveling to/from a treatment session, or completing billing activities related to the service. To support this moment, let's walk through some possible items that the TSP can maintain. The student's assessment results, the resulting assessment report that the TSP is writing, the student's IEP. Please note, if an IEP wasn't established, the TSP may want to keep record of the documents that the IEP was not established or was never established. Calendar entries related to holding time for writing the report and the upcoming IEP meeting. The possible pieces of documentation we discussed in each of these two examples are all good to have to support the direct service moments. We encourage LEAs to maintain strong documentation to support that their direct service moments are reimbursable. Now we will move on to specific documentation tied to administrative moments which any pool 1 or 2 can provide. We want to emphasize that for administrative moments, the narrative response can serve as the primary documentation source if it is a detailed enough response. DHCS encourage LEAs to work with their TSPs to ensure that they respond to their moments in a detailed and robust manner while avoiding the use of any personal information such as names. The primary piece of documentation for many administrative activities can be the RMTS moment itself, if it is detailed enough. In addition to the narrative response, LEAs may maintain supplementary documentation to further support the moment. Examples include Medicaid outreach materials, referral documentation, emails, meeting notes, any policy development materials, or calendar entries of scheduled appointments or work tasks that help explain and provide clarity on what the TSP was doing at the time of the moment. Unlike other administrative moments, however, it is required that all paid time off, or PTO, is supported by LEA records of the TSP's PTO. Now that we've covered documentation requirements and best practices, the next few slides will show examples of administrative activity moment responses and the types of documentation that can be maintained to support coding these administrative activities as reimbursable services. Here, we have an example of an administrative activity documentation for a director of student services. Who was the TSP with? They answered that they were on the phone with a non-public agency. What were they doing? The TSP answered that they were arranging transportation for a student to and from the non-public agency. Why were they doing this? The TSP was fulfilling district responsibilities for the student's IEP. This is one of those moment responses that hits all the main points, but could benefit from a little bit more detail. The TSP tells us they were coordinating with a non-public agency, but does not clarify what type of service the student receives there or whether the transportation was for a medical related service. Adding just a little bit more information, such as identifying the type of service being provided, for example, speech therapy, OT, or other medically related services required by the IEP, helps reviewers understand whether the activity supports Medicaid reimbursable activity rather than a general educational service. To support this moment, examples of possible documentation include the student's IEP, calendar entries, or referral for Medicaid services. Here we have an example of administrative activity documentation for a school social worker. Who was the TSP with? The TSP answered that they were with school counselors and admin. What were they doing? They were attending a weekly PLC meeting. Why were they doing this? They were collaborating of student services. Here, the TSP names who they were with and the type of meeting, but the narrative still lacks essential detail because it only states that TSP was in a PLC meeting discussing student services. As a reminder, acronyms such as PLC should be spelled out or defined. However, even if the acronym is fully spelled out, the name alone does not explain what was actually being discussed. The narrative should describe the specific topic of the meeting and the nature of the services being discussed. Without this information, it cannot be determined whether the activity was related to Medicaid covered tasks or general school operations, so a CQ would be needed to gather more detail. Moment responses are strongest when written in clear, plain language, as if explaining the activity to someone outside of the education field, where workplace-specific acronyms may not be understood. To support this moment, examples of possible documentation include meeting notes or calendar entries. Here is the final example of administrative activity documentation for a special education coordinator. This moment response provides a strong amount of detail for each of the pre-questions. Who was the TSP with? They answered that they were in a meeting with a vendor that provides aid for students. What were they doing? The TSP answered that they discussed about a student who required medical eligible health services through an aid. Why were they doing this? The TSP was ensuring students were provided appropriate healthcare services. To support this moment, examples of possible documentation include referrals for Medicaid services, if the phone call pertained to a referral with a vendor, meeting notes, calendar entries, or emails. All right, now for some key takeaways. TSPs should use the P.O.I.N.T framework to give clear, detailed, and supportable moment responses. Responding to moments and clarifying questions quickly helps support appropriate coding. Documentation for both administrative and direct service activities should be complete and aligned with what was described in the moment. Clear responses paired with supporting documentation help the LEA receive funding for the activities performed. If a moment does not include enough detail and lacks documentation, it cannot be coded as a Medicaid reimbursable activity. And finally, RMTS coordinators should monitor response trends, provide training, and work closely with the RMTS AU and program partners to help ensure everyone understands expectations and stays aligned. Thank you for your time today. I believe we have 3 minutes left if we want to go over a couple of questions.
Thank you, Edgar, for facilitating today. My name is Tara Gutierrez, and I am the unit chief for the SMAA program, and want to thank you all for being here today. Just want to note one of the comments that came up in the Q&A regarding the material for today. So as a just a level setting, this material was also provided in the April LEA BOP QM, and we tailored it to today's meeting so that it could reach a larger audience. Slides were sent out to both listservs, and they also were dropped into the chat as a Google link. And if you have any additional questions, the RMTS mailbox on the screen, please feel free to reach out. We do have a couple minutes, so if anybody would like to get their question answered live, if you want to raise your hand, we will get you unmuted. Otherwise, we appreciate you all being here today, and thank you to the team members who presented.
My question, I had put it in the Q&A, but I didn't see a response, is for the TSP training video, like, is there going to be a way to download that? Because like a lot of our sites block YouTube. So I just want to make sure my people will be able to see it.
Sure, yeah, and I think I did, and I apologize if you didn't see that in the Q&A. That has been shared with all of the RMTS administrative units, so I would recommend you reach out to whoever your LEC/RMTS AU is for more information on that.
Thanks.
You bet. Ashley.
Hi guys, thank you. I really did enjoy your presentation. I also have a question on the video. Is there any way to turn off the ads on that video? Because if we share the YouTube link, like 2 minutes in, I had 4 ads, and I just know my TSPs are going to complain. So I just wanted to put that out there if it's possible.
Yeah, thank you for that. We were aware of that. That is a YouTube thing, but we did share them directly with all the RMTS administrative units. So they will have that, and if they're able to house the video on a different platform, potentially we are allowing them to do with it as they may, as they can see fit if it is not user friendly on YouTube. So we appreciate that feedback. Your LECs have reached out to us for that. We have provided it to each of them in the original context. And again, if you want to reach out to your region, they may be able to provide more information.
And then Tara, I want to address 2 comments in the chat. Hi, everybody. Sarah Borkowski, manager of the LEA Provider Relations Unit. Elizabeth, thank you for providing your email. I'll have somebody on my team reach out to you. Just letting you know that if your information that you're looking for is RMTS specific, you'll want to reach out to your RMTS administrative unit. otherwise known as your LEC, but we're also happy to reach out to you as well to discuss anything LEA BOP or any program related questions that you might have. Wendy, I see a similar comment, so if you would provide your email in the chat, that would be fantastic as well.
Okay, Edgar, we're at time. I don't see any more hands.
Okay, sounds good. Thank you everyone for your time today. If DHCS was not able to get to your questions, please email us at rmts@dhcs.ca.gov. Thank you again, everyone. Have a good one.